Hello and welcome to Lecture 9 on Psychological Disorders. So now we're going to talk about schizophrenia. So we're going to define schizophrenia, and we're going to look at the symptoms, and we're going to distinguish between the negative and positive symptoms of schizophrenia. Schizophrenia is a psychological disorder characterized by a split between thought and emotion. It involves alterations in thoughts, in perceptions, and or in consciousness. So the term schizophrenia literally means splitting of the mind. Now this is a complicated disorder. It is the most difficult psychological disorder to treat. It can be the most disabling, one of the most disabling mental illnesses that there is. Basically, schizophrenia is a disconnection from reality, and it involves psychosis. So I want you to go to Moodle, and in the folder Chapter 14, Psychological Disorders Lecture Videos, I want you to watch the video titled The Voices in My Head. Welcome back. I really like that video. I think there is a misconception that there's no such thing as living well with schizophrenia. And it is not, there are people who can live fairly well with this disorder, with this disease. It is something we can treat. It's just some people vary in how well they respond to treatment. But I really appreciate this video because I think it gives a good look at, I think the speaker does a great job of looking at, here's where I was before my diagnosis. Here's how things started to fall apart when once my symptoms hit. And here's how I've actually made schizophrenia one of my superpowers. Current estimates state that between 0.5 and 1% of the population has schizophrenia, and that it affects men and women similarly. Now this points to a genetic predisposition. When there's no sex difference, that's a cue that that we need to look at genetic predispositions. A meta-analysis of 188 studies from 46 countries found similar rates for men and women. Roughly 4 to 7 in 1,000 people developed schizophrenia. Now the prognosis with treatment is better in developing rather than in developed cultures. I don't know why that is. I just know that it is better. Those with schizophrenia, they have a better prognosis those with schizophrenia have a better prognosis in developing nations and cultures than in developed cultures. So schizophrenia is characterized by a combination of motor, cognitive, behavioral, and perceptual abnormalities. Now these abnormalities result in impaired social, personal, or vocational functioning. Schizophrenia affects every aspect of the patient's life. So according to the DSM-5, to be diagnosed with schizophrenia, the person must have shown continuous signs of disturbances for at least 6 months. That's a long time. There are 5 major DSM-5 symptoms for schizophrenia, and a diagnosis requires a person to show 2 or more of these symptoms. So let's take a look at those. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and the presence of negative symptoms, which we'll talk about. So, with the DSM-5, we've got those 5 symptoms, and 2 or more of them must be present for a significant portion of a 1-month period, and there must be continuous signs of the disturbance that persist for at least 6 months. So this 6-month period must include at least 1 month of symptoms that meet criteria A. So there can be periods where the symptoms become less intense. So it doesn't have to be 6 months of continuous delusions, hallucinations, disorganized speech, negative symptoms, disorganized or catatonic behavior. It just means that there does need to be a 1-month continuous period of symptoms, and there needs to be a continuous disturbance of at least 6 months. It must affect at least one major area of your life, such as work, your relationships, self-care. So it would also affect school, parenting, things of that nature. And Part D is important right here. Other disorders and conditions have been ruled out, such as bipolar disorder, reactions to substances, or other medical conditions. So, we have positive symptoms and negative symptoms. Positive symptoms are an excess in functioning, and these include delusions, hallucinations, and disorganized speech or disorganized behavior. Negative symptoms create a deficit in functioning, such as apathy, a lack of emotion, slowed speech, slow movement, lack of movement. So positive symptoms, just think increase in functioning. Negative symptoms, deficit in functioning. So disorganized thoughts will be a positive symptom. Hallucinations and delusions are positive symptoms. Negative symptoms, lack of emotion. Sometimes people with schizophrenia have very flat affect. The inability to begin and sustain activities. Reduced speech. They start speaking very little, and sometimes their speech is extremely slow. And they withdraw socially. They're also going to show alterations in their cognitive skills, in decision making, their ability to pay attention, and in their memory abilities. So delusions, this is a positive symptom. These are false beliefs based on incorrect inferences about reality. I'm fascinated by delusions. One of the things that's difficult, I think, with disorders that involve delusions is because of the disease, because of the disorder, you can't reason out of a delusion. That's one of the defining factors of a delusion, is that people persist with their delusions despite evidence. You could give them so much evidence, but they're still going to persist in their delusion. Now, delusions are characteristic of schizophrenia regardless of culture, but the type of delusion can be influenced by cultural factors. So what the person becomes delusional about is cultural. I think here in the United States, a lot of delusions tend to be political in nature. They sometimes seem like conspiracy theories. And actually there is a form of schizophrenia, paranoid schizophrenia disorder, where the person feels like they're being persecuted by the government or religious figures or things of that nature. And so they're extremely paranoid, and their delusion is this, that they're being persecuted. So some of the common delusions and associated beliefs: persecutory, the belief that others are persecuting, spying on, or trying to harm you. Referential, the belief that objects, events, or other people have particular significance to you. Grandiose delusions, the belief that you have great power, knowledge, or talent. Delusions of identity, the belief that you are someone else, such as Jesus, or the President of the United States, or some world history figure. Could be a historical figure, could be a current figure. Delusions of guilt, the belief that one has committed a terrible sin. And delusions of control, the belief that your thoughts and behaviors are being controlled by external forces. Now, hallucinations are also a positive symptom. So this is a false sensory perception that is experienced without an external source. Now, hallucinations with schizophrenia are frequently auditory, but they can also be visual, olfactory, or somatosensory. So sometimes, if something's somatosensory, it is touch stimulus related. You feel like something's on your skin. You just feel like something's on you. Auditory hallucinations tend to be very accusatory, and that is very difficult to live with. Now, neuroimaging studies suggest that hallucinations are associated with activation in areas of the cortex that process external sensory stimuli. Something that is fascinating about hallucinations is that the brain is activating as if that hallucination is real, which is why they're so difficult. How do you convince someone that something's not real when their brain is actually experiencing it? Now, there are disorders that involve hallucinations that are not evidence of mental illness. Like some people get hallucinations with their migraines. I get olfactory hallucinations. So one of the ways I know I have a migraine coming on is I smell cigarette smoke or cat pee. Of course, I had to get disgusting smells with mine. That's not uncommon for people with migraines to have olfactory hallucinations. So I'd like you to go to Moodle and watch Anderson Cooper Tries a Schizophrenia Simulator. Welcome back. I find that to be a very powerful video. I can't imagine living like that, not being able to tune out voices, and to have voices that are accusatory. That would just, God, that seems like that would crush the soul. So, another positive symptom is disorganized speech. So, this is where someone is speaking in an incoherent fashion that frequently involves changing topics and saying strange or inappropriate things. And so the speech is disorganized in the sense that it is incoherent and it fails to follow a normal conversational structure. And something that can be present is what's called loosening of associations, where the individual shifts between seemingly unrelated topics as he or she speaks. And so it's impossible for the listener to follow the speaker's train of thoughts. The person experiencing the loosening of associations is going along just fine. They don't realize that they're skipping from topic to topic to topic in an incoherent fashion. And everyone else is just left kind of smiling and nodding because you don't want to be rude, you don't want to hurt their feelings, but you just can't keep track of what they're trying to communicate. In more extreme cases, speech is so disorganized that it's totally incomprehensible. And psychologists call that a word salad. This jumbling can also involve clang associations. It's the stringing together of words that rhyme but have no apparent link.